On a statement, the Northwest MEC of Health, Madoda Sambatha, has expressed shock after pictures of newborn babies were in boxes instead of incubators at Mahikeng Provincial Hospital surfaced on social media. The ministry has announced that it will launch an inquiry into the circumstances around why this took place. The incident happened last Saturday, and according to the department, hospital management was not made aware of this issue. Let's talk now to the MEC. A very warm welcome to MEC Sambatha. We thank you for joining us here on SABC News, sir.
Thank you very much for hosting us.
You're most welcome. Sir, you've said that you are to launch an inquiry or investigation into the incident. The nature of this investigation, or the reason for the investigation, is what exactly? Because I suppose we have kind of established that there was a shortage of incubators and cribs, and in fact, towards the end of your statement, you then admitted fault and apologized. So what's the inquiry or investigation about?
The investigation was on the reasons why babies were placed in card boxes, one. Number two, as to who took the photo and circulated. Number three, as to whether the matter was reported within formal structures of the hospital and the provincial government. And based on what I discovered just from where I got a meeting with them in the hospital at 5 until 6 today, is that like you are saying, they had 56 babies on the day.
Yeah.
And they had 47 incubators and cribs, all in all, which means in the 47, there's 9 that did not have incubators and cribs. 4 of them were placed in card boxes.
Yeah.
The others were placed to share with other ones. The practical matter is that the issue was not reported to the CEO of the hospital. And that's why it was then not reported to the provincial department, including the MEC. So an incident that occurred on Saturday was only reported to the management of the hospital yesterday.
Yeah. All right. Okay. I'm assuming that, this was then done by hospital staff. And if there is a shortage of cribs and incubators, and excuse the pun here, staff must think outside the box. What are the options?
The first issue, before thinking out of box, why would management of a facility or a manager of a unit who knows that in total for today, I have 47 incubators and cribs.
Yeah.
Why would that manager not make arrangements prior the number of babies becoming above the number that they have? 2.
Okay, the number exceeded. My question, sir, what are the options?
The first option is that the manager should have known and earlier made 2 options. Option 1, if they're not going to get extra cribs and incubators, they should have made formal referral out of that hospital to other hospitals in the province on the basis that they knew they only had 47.
Yeah. All right. It seems that you have...
And that was not done.
It seems that you've found someone to place, the blame on. You're saying that, staff should have indeed been able to assess the number of babies there would have been and made plans and provisions and so forth. Now that we've spoken about this inquiry that you'll be having, will there then be, possible consequences for those involved? Should they be found guilty? It does seem that you are laying blame on someone or some people.
For now, on the meeting I had with them, which they could not answer, 2 of them would have to be made to account for that activity. The first one is the nurse who was responsible for the ward as a supervisor on the day. The second one is the nursing manager. There's still no reason, even if we can discuss now, as to why such an incident, it's only reported to the same management of the facility only yesterday.
Yeah.
From Saturday. No report whatsoever to the management, no report whatsoever to the CEO. But get my action. When I said in the morning that if the case is the shortage of cribs and incubators, let management of the province find them to any facility in the province that had additional. On my arrival, 18 cribs and incubators are already delivered to the same hospital, which means had they made an earlier arrangement, the issue would have never been non-availability, because it is not non-availability in the whole department. It was non-availability in their facility.
Yeah. All right. You, as a department, you've apologized, one. But you've also, very interestingly, called for calm while the matter is being investigated. Who are you calling for calm from? Or were there concerns that, people were, well, obviously they are upset, but, the fact that you're calling for calm, why? Why is that?
We're calling for calm on the basis that this photo is circulated in public. We therefore aren't aware of what could be conclusions of community members first. Secondly, we're calling for calm because this has to do with the behavior of employees, and therefore would have to deal with relationships that you would have with unions. Thirdly, we're calling for calm because this should have never happened in any case.
All right, so let's leave it there. Thanks very much, MEC Madoda Sambatha, Northwest Health MEC there. Of course, on the back of the shocking pictures, he's expressed shock after pictures of newborn babies were in boxes instead of incubators at the Mahikeng Provincial Hospital, which have indeed surfaced then on social media.